So this lecture we're gonna talk about AI because we talked about that before, but we have more student here, so we can expand that about this lecture. I want to show you some videos about the AI first. Okay. Okay, so this is a robotic arm AI. So let's see if you can see that.
So here we have Yomi prepared for surgery at this point. We have planned the case. An implant in the lower right, we have number 30. The extraction's already been done. At this point, we have the robot arm is in guided mode. So it's free to move anywhere when I'm far from the site of surgery. But as soon as I get within a few millimeters of the surgical site, it's going to stop me. And it says the angle needs to be corrected to match the plan. So on screen, it shows me to tilt the handle up. It shows me my angle error is about 15 degrees off. Most importantly, it physically guides me. So by applying just a little bit of force, it brings me to the correct angle. If I try and push the wrong way, it feels very stiff and heavy. So I'll take it all the way the correct direction until it stops me again and says, okay, now you have the right angle, but you need to translate to get to the starting position. It's saying on the screen, I need to move about 5 millimeters distal and lingual. Again, physically, it's going to be very easy. So I just slide distal and lingual. It stops me again when I have the right position. So now I've got the right angle and the right position, and I can only drill in and out of the osteotomy. I can't deviate from that position or angle. So at this point, I would drill down, complete the osteotomy, and then back out. And you'll notice if I let go, the system, you'll notice if I let go, complete.
Can you see the black thing? The black thing is like
Yeah.
that's when we take impression, usually either digital or regular impression, and send it to the upload it to the AI machine. The AI machine has that black thing will set up on the teeth, so the AI will know where's the patient gonna sit. So that's as like a impression coping for the teeth. So the AI will know where's the patient location in the space in the 3D space, the 3D space, and then the other arm that it will guide it, the surgery, the drill.
The osteotomy and then back out, and you'll notice if I let go, the system will only rotate about the axis, but it won't ever change position or angle. It'll stick with the planned trajectory. If I move the patient, you can see the drill will always follow with the patient motion. Complete the osteotomy, I keep pulling back, and it lets me into free mode.
So this one, I'll show you the other one. I think you like this one, Kabuna. Kabuna was it will create the future bridge of future fillings for the patient. Before that, before the Kabuna was, yeah, we need to take impression for the patient, and we build up wax buildup or mock-up, and then we show it on the cast, and the patient will agree or disagree, or you want a different color, different shape. But now, like immediately, you can show the patient before, after, and you can change the color, the shape, the shade. All these things can be changed. That's the other one. See. So this will be great for marketing because you can send the link to the to the patient, and the patient will go to log into that and will see the difference. And even if they are home, they can do that. They can see the future fillings or bridges. I think this one need to take impression. This is the digital impression. Let's see the other one. So this,
one of the things I love about Pearl is it helps me be a better diagnostician. Even though it's a second opinion, it's a very valuable second opinion. For instance, if you look at this indication of caries in pink, it shows that it is 100% an enamel. Now, for me, to be conservative, I would not address that tooth at this point. It might stop right there. However, if you look at the one, the first smaller on top, it shows it's 14% indenting. I might have very well missed that without this, and it gives me a better idea of when to start. Now, on the other hand, take a look at the third one here, 73% dent. You can't wait. Okay, in order if you're going to save that tooth, you've got to remove it. Okay, this gives me a great way to do it. In addition to that, if you go up to the, what do I call it, color, and you notice that the enamel's in purple, the dentin's in green, and just what we talked about. It's just got into the dentin on the upper molar. It's not into the dentin on the lower. Pearl helped me figure that out and diagnose better. I love it. We use it every day.
Yeah, the 3 easy points of DiagnoCAD are it's easy, affordable, and it's great communication for the patient. All right, here's what DiagnoCAD can do. It's AI software, cloud-based software. As you can see here, we have a full mouse series. Let's click on the tooth number, and you have your diagnosis by DiagnoCAD. You got periodontal bone loss, you have dental calculus. It'll show many different conditions in the mouth. We do 2D and 3D, so we can do also a CBCT. It'll find over 65 conditions on 3D. Let me show you a report. Up comes the report, just like the 2D, but you also have the slices, so you can get very detailed diagnosis by the DiagnoCAD. And it also prints a report that makes it nice and convenient for you and your patients. Have details, has your contact information, has your logo, has all the details of the treatment plan that just was presented. DiagnoCAD. The future is here, all in one, 2D and 3D.
Yeah, so so these some of the AI programs, and they are coming very fast. And you know, the the machine that we have, the 3D scanner, 3D printer, they have some AI because they can they can set up the teeth in different positions. So the AI is growing, but they're getting faster and faster and getting crazier, and comes in everywhere. So if you, I told my other student that in the 80s, people who don't know how to read, they were illiterate. In the 2000, people who don't have access to the internet, they are illiterate. But nowadays, I think in the coming years, if you don't know AI, you're illiterate. Because AI is coming everywhere, either your phone, the new cars, the everything. So that's it's gonna be the future. So so AI changed everything in dentistry. It's growing. It changed everything in everywhere, and it's coming so fast and grow by months and months that we can see there's a change, the new version, and each company, they will have their own AI. Now Google, they have Gemini. They push Gemini. The Microsoft, they have Copilot. I don't know what they have, the Suno. The Suno, remember we made songs? You can make songs, whatever, even like I made songs about dentistry, and it's almost they all free, and so it's coming so fast. You have to learn about it. You have to embrace it. You cannot. I think I showed you the picture in 1966. The math teacher, they went on strike because there was a law that led the student to bring calculator to the college, and everybody, the math teacher, were upset. They said that's gonna destroy the knowledge, and but it's not. It's you cannot fight it. You can when the AI started, the college, we had meeting, and we get what we're gonna do about the AI and how we're gonna teach. So we have to change the way we teach. It's like the old ways is changing. That's why I remember when I gave you assignment, I gave you a subject, and you're gonna present that to me. And so you'll have to learn about it, and you have to present it. It's different from all time. We give you essay or MCQ. It's changing. So dentistry is a part of any medical field. Is growing very fast, and it's changing from the 100 years made a big difference, make big changes. And I saw the video about the Columbia University. They're gonna record everything, communication between the patient, the student, and the professor, and they record that. And they have the wide angle cameras and record everything, and they upload it to the cloud. And within maybe 10 years, 4 years, the AI will teach the student. You don't need the professor. Even the oral surgeon, remember that's machine Yomi. That's, we spend a lot of years to train ourselves, become an oral surgeon, and we know the feeling of the feeling when you touch the tooth, the tooth gonna fracture, the buccal plate gonna fracture, and you have this experience, and you know where to drill, and you know where's the sinuses, where's the nerve. Nowadays, there's these Yomi, and there's another app called Deep Care. It will let you know the tooth if gonna fracture, or the buccal plate gonna fracture, the root gonna fracture during extraction. So that's another thing gonna replace the experience of professor, but it's not gonna replacement 100%, but at least will give advantage to the new generation. So a long time in dentistry, as we trained, there is a professor who taught how to touch, how to examine, how to extract the tooth, how to do fillings, how to do the diagnosis, and it takes years of training, years of practice, and the knowledge and the cases. Then after a few years, we become specialists, and I'm teaching you, the new generation. So the theory that The theory is coming that the cases, the knowledge is going to be uploaded to the cloud, to the AI training, to the deep training, to so all this information and the cases is going to be machine learning, and machine learning can help to educate the new generation. It's not going to be 100% change, replace the professors or us, but it's coming sooner or later. And there are 3 steps that's helped to digital dentistry to become an AI in dentistry program. First thing is digital X-ray. I remember when I was in college, we had to process the X-ray films. I remember some of you remember the cameras, the old pictures. You have to process the pictures. But when digital digital X-ray came, it changed a lot. And intraoral camera, where you can have a good vision about the oral cavity, the palate, the tonsillar area, the teeth, the gingiva, the cheek, with intraoral camera. Then started the digital dentistry. We went a 3D printer, a 3D scanner, and a communication. We can take impression by scan the teeth and email it to a company in California, and they have the 3D printer. Or you can design it and send it to them, and they 3D print that the crown or the complete denture or the bridge, and they ship it back to you. And there's a machine like 10 years ago. There's CEREC. They have the camera. It has a scanner, a very fast camera. It will scan the tooth after preparation, and there is a milling machine. It will mill the crown, and that was one of these first steps. About the digital X-ray, why it's a big deal. Human eye there's a different shade of a gray. Human eye, one of these books, they said about 90 shade of a gray the human eye can see. While AI or machine learning can diagnose thousands of shade gray shading. The gray shading, when you take X-ray, the harder tissue will absorb more, the lesser tissue will absorb less. That's why the enamel looks white, the dentin looks less white, the decay will be less white, the pulp, because it's a soft tissue, will absorb less. If there's bone loss, you have less white. We have thicker bone, we have more white. And the difference in shade will be sometimes varied. If there is in the position, it's also different. But the AI, this is how the machine learning, it's a big deal. About this is the new future. Remember I told you about there's a company, German company. They start in 2006. They start uploading the cases, pictures, and they put the picture of an abscess, periapical abscess, and thousands of pictures of periapical abscess, and they upload it to the machine. Then they upload, this is a part of bone, and the machine, like model learning, first they will learn what's a bone, what's a normal bone, and then they learn what's a abnormal bone, if there's infection or abscess that's destroy the bone. And this is models, and they create a new model for enamel, and then another model for dentin, and then they will upload another model for decay in enamel and decay in dent. So it's a long process, but they build it from like machine learning step by step. And the deep learning, there's a deep learning is a big deal, because they make the learning is like the human brain connection, and but it will be faster for the machine to learn about these things. In medical field, they have it they start before dentistry, especially in radiology. in dermatology, and when they upload the pictures of skin conditions, and they make an app. If you take a picture of the skin lesion, it will give you about 90% perfect diagnosis. But in dentistry, that's we just rising about like the 5 years or 10 years, last 5 years. That's what it become more and more advanced. So this is the 3D X-ray. 3D X-ray will show you the bone, the nerve. They show you the teeth, the occlusion, the bite, how much bone loss, where's the vital structure. And we have, when we do implant, we have limitation. We have the sinuses, we have the nerves, we have the buccal plate, how much bone we have the, the thickness of bone. The regular dentists, we think about, we see the X-ray and we think of, you can use this we can use this this size of implant. The AI make it easier because it will calculate all these variation, limited the vital structure, the amount of bone remaining, the amount of gingival remaining, how much the space, the size, and angulation. It saves you a lot of time on preparing and diagnosis. It's also aided diagnosis. There's one, it will orthodontics. It will show the patient before and after, if they do, especially if you have a young patient, when they are 12 or 13 and they take X-ray and take intraoral pictures, and you can show the patient and their parents about how's the growth of the teeth going to be, if they're going to have malocclusion, if the teeth going to be messed up, or what the treatment option. And it can be done by the now, because it can be app. You can send it to the patient, and the patient can see it with their phone. Surgical assistant. Now remember, we can do surgical guide, but also we can use the robot like Yomi. It doesn't need, it's surgical guide, but it's more expensive surgical guide. And because it know the anatomy, the condition, the space, and the future about that. And so aid in diagnosis and wisdom teeth impaction. With our experience, I can tell these wisdom teeth are impacted, but how much impacted? This is like 51% impacted, 57% number 32, the lower lower right wisdom tooth. And also remember in America we have insurance company, and the insurance company will pay different from simply impacted, mesobuccal impacted, or bony impacted, or soft tissue impacted. Is it different? So it helped in uniform diagnosis, and the insurance company will love that, because you can send this to the insurance company. Insurance company immediately, they don't have to have their oral surgeon specialist to see the X-ray, because the AI will let them know these teeth are impacted or bony impacted, so they're gonna pay for the bony impacted, or they are soft tissue impacted, which is different cost for the patient. For example, this is I can see, if I have experience, I can see I can recognize that there's a fracture here in this this implant, but I couldn't see this one. So sometimes you can miss that exposed margin. The AI can immediately will follow the margin, and you see there's a defect in the margin, and there's a fracture in the implant. So sometimes some dentist and oral surgeon can miss that fracture because I told you the shade of gray, how much gray, and if you have inflammation, might affect the X-ray resolution, and so AI gonna help you with that diagnosis too. We saw that Kabuna is also a German company, and for office, dental office, most of dental office now, they have their software is uploaded to the cloud, and their pictures are cloud over the cloud. There's it will help in billing, patient record, salaries, and they have information of the patient, and they send a personalized email to that patient. Like this patient, they know that they have a dog, and they ask him about how is the dog is doing, or because all this information is related to that patient will be there. This patient works certain hours, and they can text him that's when certain hours that he's not working or she's not working. And for administration, it's very big, efficient. We use that AI to help us in writing emails too. Prosthodontic become a big deal. The diagnosis, the digital flow of information between digital scanner to the 3D printer, to the preparation, to the designing, everything helps a lot. For root canal also, there's one program called Overjet. It will show if there's a leak of the cement, if there's a still parabical lesion, if there's a void, if there's a missing one of these canals, the root canals, if they are filled 100% or not, because the AI will know the shade if there's parabical lesion like this one, the lower first molar, you can see there's lesion. I might notice that something here, there's the bone loss, but the AI will definitely would know where is that, and definitely know the cataperture, the filling of the root canal. Also, the AI immediately know how much bone lost you lost, and when you go to the dentist, the hygienist will measure the bone loss, how much 2, 3, 4. But if you have this one, we'll read the X-rays immediately will tell you how much bone lost, or if you have calculus. Oropathology also, because oropathology is a part maybe because it's you have all these cases uploaded, so they can diagnose it early, and then will give you option of the treatment, especially in area we cannot access. Remember we talk about the oral cancer, especially HPV related oral cancer, will happen in the back of the tongue and the tonsillar crypt, and we cannot see it, but if you have a special camera, it will show that, and will show early lesion. Early lesion sometimes not visible for dentist and oral surgeon eye, but AI with this camera magnification, they can diagnose the change. Unfortunately, most of HPV-related oral cancer now diagnosed by when there's lymphatic involvement, when cervical lymphatic involvement, and you can which is too late for the treatment. And we have digital scanner, digital 3D printer. I think that was before AI, like when we got our 3D printer, our 3D scanner, it already has some AI information that will let you know where's the teeth gonna be, and will arrange the teeth, the size of the teeth, even the orientation of the teeth, the occlusion. But nowadays they upload more of the facial feature. They can upload the TMJ condition too, because the digital calculation is more now and more advanced, and everything is on the cloud, and it will be faster. We talk about AI in dentistry and oral surgery was a big deal, bone reconstruction, trauma management, and I have the X-ray when the AI will show you there's a sinus involvement. Sometimes you can tell there's an abscess on upper first molar, when sometimes the sinus will be involved. Sometimes you never know because it's it's especially if you have 2D X-ray. But with the 3D X-ray, you will know if there's an abscess there, if there's a fracture, you cannot see it, or you can tell about the diagnosis, also the treatment plan. Ethical and regulation. In America, we have medical fraud is a big deal, especially Medicaid fraud and dental fraud. And sometimes the diagnosis of the tooth need to be filled or not. If AI program is going to be universal, every dentist has to get that, and the AI will know if there's a decay or not, because now we depend on the dentist diagnosis. And if the AI will tell there's a decay in the enamel or decay in the dentin, and the pulp is not evolved, the patient doesn't need to have a root canal. But if they say the patient needs a root canal, it's a different. But it's still, there's a wiggling space and need time for these to be generalized. Not everybody will buy these programs; they are expensive, but it's going to be cheaper. Yomi, the robotic is about, I think, 27,000 a month. You have to pay for 2 years until you will get. This is the whole cost of it. But if you have a good business and it's working, why not? You pay for these AI programs. Okay, so future of dentistry is going to be AI is going to be teledentistry, going to be more advanced, and we might have some troubles too, because Invisalign nowadays they have a problem, because some dentists, they hate Invisalign, because Invisalign now can access to the patient without the dentist. They send them impression material, and the patient will take impression by themselves or herself, and then they send it back to the Invisalign. Invisalign, they will scan it, and they might do the the appliances, a retainer, and might they skip the dentist in general, the dental lab technician, they skip that. But it's still need more regulation, need to be more knowledge about these, as they still in the beginning. This is the second opinion from Patterson. It will show there's a decay, how much decay, 100%, 2%, we saw the video about that. It's a real-time diagnosis. It will show you the bone loss and show you there's a decay, there's a calculus. And the precise where's the amount of decay we have, like it's in dentine or enamel. So AI here, the AI with the dentist, they are almost related. Dentists a little bit more than the AI, but with time the AI will be more advanced than dentist does the diagnosis. And visible color, whenever this one, it's good for the patient education. When you change the color of the enamel, and the patient will know where's the decay in the enamel, or there's a pulp involvement, or just in the dentin, why this tooth is sensitive. Why, let's see this other picture. Yeah, where the decay has started. This is even the filling will show the filling a different color. And the percentage of the decay, with the decay detection, it will show the bone loss, how much bone loss, and exposed margin. There's calculus, and there's preapical area, and there's an Denti AI. It's like a hygienist will measure the depth of periodontal probing, and also help in the diagnosis, and save time for the hygienist. We saw the diagonal cut. Diagonal cut is a big deal. I like it more because it has more maxillofacial, not only dental. It has, it will show individual tooth, how much periodontal disease, bone loss, if they have artificial crown, if they have a root canal, a missed root canal, if there's a root canal void, if something wrong with the root canal, if there's a preapical abscess, preapical radiolucency, and here there's a sinus involvement here. It will show the sinus involvement. I can from the periapical I can see this sinus is involved, but this one I couldn't diagnose it by but the AI can see that. Good. This is the overjet. One of the biggest one is also overjet, and it's the same as the other one, as the Patterson one. It will show the bone loss, the decay, and calculus. And also, overjet has a big deal with the root canal therapies. Also, you can see the fillings, the extra canals here, root canal, because these are regular X-ray, we cannot see it. And most of the now endodontists with the root canal specialists, they have to seal all these things. Smilify is just like Pacuno. That's the other one, Capuno. It's just the other one. It will give you wax up, a mock-up. It will design the teeth, will the prosthesis in general to be fit with the orientation of other teeth. Shade, and it will find the thickness of the prosthesis in general. Oh, this is the list of the AI powered. Invisalign, they have AI powered 3Shape. The one we have 3Shape scanner, and Kleinenke is a German company, one of this big one. These are the rest of them. These are the 10 I found them online. So AI is gonna revolutionize our work. So we have to know about them. We have to learn about these software. You have to know. So it's the future is coming like that. Any question? No.
So basically, in the future, AI gonna be taking over everything.
Well, yeah, it's taking over everything. Yeah, it's gonna be involved in many things. I told you, medicine is a big deal. Diagnosis, robotic surgery, the treatment planning, and that's gonna be the future. But in dentistry, slowly, it's not gonna replace the expert immediately. No, it takes a while for it to replace the expert, but the expert needed. So I want you, the new generation, you have to learn about that. So at least you can program it, you can design it, you can work on it, and because you can make your own AI. So because the basics is the same. You have knowledge, and you accumulate that knowledge, and you have fast computer capability. And you build it on, and you can add your diagnosis, your work, your design of prosthesis, the occlusion, the bite, vertical dimension, horizontal dimension. Nowadays, remember when we take the vertical dimension, we have to have all these appliances. We can make the denture base, the record base. But with AI, where they have all their picture, all their models, immediately they know the vertical dimension, the horizontal dimension, and they can predict the occlusion, the bite. They can do that, but at least they need a specialist like you to work on it, or do the scanning, or to do the final restoration, need to be polishing, or the packing of the dentures, all this.
Okay.
Yeah, so you have to learn about these. Yeah.
All right.
Okay. All right, gonna stop about the recording.